Top 25 endoscopy nurse interview questions and answers. Preparing for an endoscopy nurse interview requires a strong understanding of patient care, procedural knowledge, infection control, sedation monitoring, and teamwork within a fast-paced clinical environment. Endoscopy nurses play a critical role in assisting physicians during diagnostic and therapeutic procedures, while ensuring patient safety, comfort, and education. Employers look for candidates who demonstrate clinical competence, attention to detail, communication skills, and the ability to handle emergencies calmly. In this guide, we cover the top 25 endoscopy nurse interview questions with well-structured answers to help you confidently prepare and present yourself as a skilled and compassionate healthcare professional. 1. What are the primary responsibilities of an endoscopy nurse? An endoscopy nurse is responsible for preparing patients for procedures, assisting physicians during endoscopic examinations, monitoring patients throughout the procedure, and providing post-procedure care. Duties include verifying patient history, ensuring informed consent, preparing equipment, maintaining sterile environments, and administering medications as prescribed. The nurse monitors vital signs and sedation levels, ensuring patient safety at all times. After procedure, they assess recovery, provide discharge instructions, and document findings accurately. Strong communication, attention to detail, and knowledge of gastrointestinal procedures are essential. The role requires both technical competence and compassionate, patient-centered care in a fast-paced clinical setting. 2. How do you prepare a patient for an endoscopy procedure? Preparation begins by reviewing the physician's orders and verifying patient identity. I assess medical history, allergies, current medications, and NPO status. I explain the procedure clearly to reduce anxiety and answer any questions. Consent is confirmed, for access is established if needed, and baseline vital signs are recorded. I ensure appropriate bowel preparation for colonoscopy cases and confirm understanding of sedation expectations. Equipment and monitoring devices are prepared in advance. Emotional reassurance is equally important, as many patients feel nervous. Proper preparation improves patient safety, enhances procedural efficiency, and reduces the likelihood of complications during endoscopy. 3. How do you maintain infection control in the endoscopy unit? Infection control is crucial in endoscopy settings. I strictly follow standard precautions, including hand hygiene, use of PPE, and proper disposal of sharps and biohazard materials. I ensure endoscopes are thoroughly cleaned, disinfected, and stored according to facility protocols and manufacturer guidelines. High-level disinfection processes are monitored and documented carefully. Surfaces and equipment are sanitized between procedures. I also educate patients and staff about infection prevention practices. Adhering to guidelines minimizes cross-contamination risks and protects both patients and healthcare workers. Consistent compliance with infection control standards ensures a safe clinical environment and high-quality patient care. 4. How do you monitor a patient under sedation? Monitoring includes continuous assessment of vital signs, such as blood pressure, oxygen saturation, heart rate, and respiratory rate. I observe the patient's level of consciousness and airway patency while documenting changes promptly. Capnography may be used when available. I stay alert for signs of respiratory depression, hypotension, or allergic reactions. Emergency equipment and reversal agents are always readily accessible. Effective communication with the physician is essential during sedation. My priority is ensuring patient safety by recognizing early warning signs and responding quickly. Proper monitoring reduces risks associated with sedation and supports a smooth recovery process. 5. What types of endoscopic procedures are you familiar with? I am familiar with upper GI endoscopy, EGD, colonoscopy, flexible sigmoidoscopy, ERCP, and bronchoscopy. Each procedure has specific preparation requirements and monitoring considerations. I understand the indications, potential complications, and post-procedure care associated with these interventions. For example, colonoscopies require bowel preparation verification, while ERCP may involve higher sedation levels and closer monitoring. I assist with biopsies, polyp removal, and therapeutic interventions. Being knowledgeable about different procedures helps anticipate physician needs and ensure smooth workflow. Familiarity with equipment handling and patient positioning enhances both efficiency and patient safety during procedures. 6. How do you handle a patient experiencing complications during a procedure? If complications arise, I remain calm and immediately assess the situation. I monitor vital signs closely and inform the physician promptly. Depending on the issue, such as hypotension, bleeding, or respiratory distress, I assist with emergency interventions, oxygen therapy, suctioning, medication administration, or calling a rapid response team may be necessary. I ensure emergency equipment is available and functioning. Clear documentation of events is completed afterward. Remaining composed under pressure ensures patient safety and team coordination. Quick recognition and immediate action are vital to preventing further deterioration and ensuring the best possible patient outcomes. 7. How you educate patients after an endoscopy. Post-procedure education includes explaining expected side effects such as mild bloating, throat discomfort, or drowsiness. I provide written and verbal discharge instructions, including dietary guidance and activity restrictions. I inform patients about warning signs such as severe pain, bleeding, fever, or difficulty swallowing. I ensure they understand sedation precautions, including avoiding driving for 24 hours. Questions are encouraged to confirm understanding. Education empowers patients to manage recovery safely at home. Clear instructions reduce anxiety and prevent complications. Effective communication is essential to ensure compliance and promote positive patient experiences after discharge. 8. Describe your experience with documentation in an endoscopy unit. Accurate documentation is essential for legal, clinical, and quality assurance purposes. I record patient assessments, medications administered, sedation levels, vital signs, procedure details, and recovery progress. I ensure documentation is completed promptly in the electronic medical record system. Any complications or unusual findings are clearly noted. I also document equipment tracking and sterilization verification when required. Thorough documentation ensures continuity of care and supports compliance with healthcare regulations. Attention to detail prevents errors and protects patient safety. Maintaining organized and accurate records reflects professionalism and accountability in clinical practice. 9. How do you manage anxious patients before procedures? I acknowledge their concerns and provide reassurance through clear explanations. I use calm communication and allow them to ask questions. Explaining what to expect reduces fear of the unknown. I maintain a supportive tone and offer relaxation techniques, such as deep breathing. Involving family members when appropriate can provide additional comfort. Building trust is essential to easing anxiety. I also coordinate with the physician if additional sedation support is needed. Compassionate care improves patient cooperation and overall experience. Emotional support is just as important as technical competence in endoscopy nursing. 10. Why do you want to work as an endoscopy nurse? I am passionate about providing specialized patient care in a procedural setting. Endoscopy nursing combines technical skills, patient interaction, and teamwork. I enjoy working in environments where attention to detail and rapid assessment skills are essential. The role allows me to support diagnostic and therapeutic procedures that significantly impact patient health outcomes. I appreciate the fast-paced workflow and collaborative nature of the unit. Continuous learning and exposure to advanced techniques motivate me professionally. Being able to comfort patients during vulnerable moments makes this specialty particularly meaningful to me. 11. How do you prioritize tasks during a busy shift? I prioritize tasks based on patient acuity, scheduled procedures, and safety considerations. Pre-procedure assessments and sedation monitoring take precedence. I organize supplies and prepare equipment ahead of time to prevent delays. Effective communication with team members helps coordinate workflow efficiently. I remain flexible and ready to respond to emergencies. Time management and delegation, when appropriate, are essential. Staying organized ensures that patients receive timely and safe care. Prioritization reduces stress and improves unit efficiency. Maintaining focus under pressure is critical in a fast-paced endoscopy environment. 12. What would you do if a patient had an allergic reaction to sedation? I would immediately stop the medication and assess airway, breathing, and circulation. Oxygen would be administered, and emergency medications such as antihistamines or epinephrine prepared as ordered. I would notify the physician immediately and monitor vital signs closely. Emergency equipment would be readily available. Documentation of the event would follow once the patient is stabilized. Quick recognition and response are critical to prevent escalation. Patient safety remains the highest priority. Following emergency protocols ensures appropriate management of allergic reactions in the endoscopy unit. 13. How do you ensure patient privacy and dignity? I respect patient confidentiality and follow HIPAA regulations. Curtains and doors are kept closed during procedures. I ensure proper draping and limit exposure only to necessary areas. Conversations regarding patient information are conducted discreetly. I involve patients in decision-making and explain each step respectfully. Maintaining dignity improves trust and comfort. Protecting privacy reflects ethical and professional standards. Respectful treatment enhances patient satisfaction and promotes a positive healthcare experience. 14. How do you work effectively within a multidisciplinary team? I communicate clearly and respectfully with physicians, technicians, and other nurses. Collaboration ensures smooth workflow and patient safety. I actively listen to team input and provide updates regarding patient status. Mutual respect fosters a positive working environment. During procedures, anticipating physician needs enhances efficiency. Teamwork improves patient outcomes and reduces errors. Supporting colleagues during busy periods strengthens unit performance. A cooperative approach is essential in endoscopy settings. 15. What qualities make a successful endoscopy nurse? Key qualities include strong clinical skills, attention to detail, compassion, and excellent communication. The ability to remain calm under pressure is crucial. Critical thinking and quick decision-making support patient safety. Organizational skills ensure efficient workflow. Empathy helps build patient trust. Commitment to infection control and safety standards is essential. Continuous learning enhances professional growth. A successful endoscopy nurse balances technical competence with patient-centered care. 16. How you handle difficult or non-compliant patients. I remain calm and professional while trying to understand the reason behind the patient's behavior. Often, fear or misunderstanding causes resistance. I explain the procedure clearly, address concerns, and reassure them about safety measures. Active listening helps build trust and cooperation. If needed, I involve family members or the physician for additional support. Maintaining empathy and patience is essential. My goal is to ensure patient safety while respecting their autonomy and promoting understanding. 17. What steps do you take during patient recovery monitoring? During recovery, I monitor vital signs, oxygen saturation, and level of consciousness until the patient meets discharge criteria. I assess pain levels, nausea, and any bleeding. I ensure protective reflexes have returned before allowing oral intake. Documentation of recovery progress is completed accurately. I provide discharge instructions and confirm understanding. Close observation helps identify complications early. Safe recovery monitoring ensures the patient is stable before leaving the facility. 18. How do you stay updated with best practices in endoscopy nursing? I participate in continuing education programs, workshops, and online training modules. Reading professional journals and attending in-service sessions keeps me informed about new techniques and guidelines. I follow evidence-based practices recommended by professional nursing organizations. Networking with colleagues and joining professional associations also supports learning. Staying updated enhances patient safety and improves procedural outcomes. Ongoing education is essential in a specialty that frequently adopts new technologies. 19. How do you ensure accurate equipment handling? I inspect all equipment before procedures to ensure functionality. I follow manufacturer guidelines for setup, cleaning, and storage. Any malfunction is reported immediately. Proper handling reduces procedural delays and infection risks. I also verify accessory instruments are available and sterile. Maintaining familiarity with equipment enhances efficiency. Accurate equipment management supports patient safety and smooth workflow in the endoscopy unit. 20. How do you manage stress in a high-pressure environment? I manage stress by staying organized and prioritizing tasks effectively. Deep breathing and maintaining focus help me remain calm during emergencies. I rely on teamwork and clear communication to reduce workload pressure. Reflecting on experiences and maintaining a healthy work-life balance supports resilience. Staying composed ensures patient safety and professional performance, even in challenging situations. 21. How do you handle confidential patient information? I strictly adhere to HIPAA guidelines and facility policies regarding confidentiality. Patient information is accessed only when necessary for care. I avoid discussing cases in public areas and ensure electronic records are secured. Maintaining confidentiality builds patient trust and protects legal compliance. Respect for privacy is a fundamental nursing responsibility. 22. What would you do if equipment failed during a procedure? I would remain calm and immediately inform the physician. Backup equipment will be prepared quickly to minimize disruption. Patient safety remains a priority. I would monitor the patient closely during the delay. After the procedure, the malfunction would be reported and documented according to protocol. Preparedness reduces risk and ensures continuity of care. 23. How do you contribute to quality improvement initiatives? I participate in audits, review incident reports, and suggest improvements based on observations. Monitoring infection rates and patient feedback helps identify improvement areas. I follow updated protocols and encourage team compliance. Quality improvement enhances patient outcomes and unit efficiency. Active participation demonstrates commitment to excellence. 24. Describe your approach to patient-centered care. 90 words. Patient-centered care involves respecting individual preferences and values. I listen actively and involve patients in decisions. Clear communication ensures understanding and comfort. Providing emotional support alongside clinical care improves overall experience. Tailoring care to each patient strengthens trust and satisfaction. 25. Where you see yourself in 5 years as an endoscopy nurse? In 5 years, I aim to deepen my expertise in advanced endoscopic procedures and possibly pursue certification in gastroenterology nursing. I hope to mentor new nurses and contribute to quality improvement initiatives. Continuing education and professional growth remain priorities. My goal is to become a highly skilled, reliable team member who consistently delivers excellent patient care. Succeeding in an endoscopy nurse interview requires preparation, clinical knowledge, and confidence in demonstrating both technical skills and compassionate care. Employers seek candidates who can ensure patient safety, maintain infection control standards, monitor sedation effectively, and work collaboratively within a multidisciplinary team. Reviewing these top 25 interview questions and practicing structured answers will help you communicate your expertise clearly. Focus on highlighting real-life experiences, critical thinking skills, and dedication to patient-centered care. With proper preparation and a professional approach, you can confidently present yourself as a valuable asset to any endoscopy unit.